Can hip flexion cause dislocation after hip replacement? Imagine bending your hip and feeling unsure if it's safe. That's a common concern after a hip replacement. You might wonder if certain movements could cause your new joint to come out of place. After a total hip replacement, the artificial joint replaces the damaged parts of your hip. This surgery is often done to relieving pain from osteoarthritis and restore mobility. But because the natural anatomy is altered, the joint can be more vulnerable to dislocation. Hip flexion is when you lift your thigh toward your abdomen, like when you sit down or bend forward. This movement can cause dislocation if it goes beyond a certain angle, especially in the early months after surgery. Usually, bending past 90 degrees, meaning sitting in a low chair or bending forward too much, can put the joint at risk. Dislocation happens when the ball part of the joint slips out of the socket. This can happen if the implant is not positioned correctly during surgery, or if the soft tissues around the joint don't support it well. If the implant is malaligned, such as having too much anteversion or retroversion, certain movements like hip flexion combined with inward rotation can increase the risk. Soft tissue repair during surgery helps keep the joint stable. If muscles and capsules are reconstructed properly, the joint is less likely to dislocate. Postoperative precautions often include avoiding bending the hip beyond 90 degrees or crossing your legs. These rules are meant to prevent the femoral head from slipping out of the socket. However, recent studies suggest that strict restrictions might not be necessary if the implant was positioned well and soft tissues are intact. Still, patients with muscle weakness or neurological issues may need to be more cautious. Pre-existing conditions like osteoarthritis can affect stability because they often cause joint deformity and muscle weakness before surgery. This makes proper surgical planning and patient education even more important. Patients should learn safe movements and avoid risky positions, especially in the first few months after surgery. To stay safe, avoid bending your hip too far forward, especially when sitting or squatting. Use assistive devices like walkers or crutches as recommended. Follow your physical therapy plan to strengthen muscles and improve joint control. If you experience any sudden instability or pain, contact your doctor immediately. In summary, hip flexion can cause dislocation if it exceeds safe limits or occurs with other risky movements. Proper implant placement, soft tissue repair, and patient adherence to movement precautions all help prevent this complication. Managing these factors is key to maintaining a stable, functional hip after replacement for osteoarthritis.